why do you think biomarkers are so important in Alzheimer's disease? If you would have to convince someone pretty new with the use of AD biomarker, what would you say?
Yep. We know that the neuropathologies of Alzheimer's disease, they start to appear much earlier than the clinical symptoms. And with much earlier, it's a decade or even 15 years. Some studies suggest that the first changes happen 20 years, at least 20 years before you get dementia. And when we now try with better therapeutics to interfere in these pathways, we would like to interfere before you have breakdown of the neuronal networks. So ideally, we would like to get into the pre-symptomatic phase and stop the disease process before you get neuronal loss. And that's where we really need these biomarkers. And then, of course, we have rather good biomarkers in cerebrospinal fluid and with imaging technologies. But these biomarkers, they are relatively expensive. They are not accessible everywhere. And if we could have blood tests, which is so, I mean, that's really standard in clinical practice in all disciplines of medicine, to take a simple blood sample and send off to a lab to measure something, then if it would work to use them early on in the diagnostic evaluation of people who have mild symptoms, that will help those patients to get to a faster and more accurate diagnosis. And if we eventually in the clinical trials also can use them to find preclinical Alzheimer's pathology, treat it and follow the patients and see that symptoms do not appear, that would be wonderful.
Thank you very much.